Hi everyone, Dr. Emmy from Pain Free and Fit. Today we continue our series on how to get your sacroiliac joint back into place. We're going to cover the topic of lateral pelvic translation and how that tightens and misaligns your sacroiliac joint and causes pain. We'll be discussing an analysis to see if this is part of your sacroiliac condition and a simple exercise to help restore proper alignment in your sacroiliac joint and relieve pain. Hope you enjoy. So if you've seen our other videos in this series on sacroiliac joint position and corrective exercise, you realize that the sacroiliac joint can become misaligned in a bunch of different directions, and a targeted exercise based on an analysis of your sacroiliac alignment is going to be much better in terms of getting you out of pain and keeping you out of pain than a generic exercise approach or muscle energy techniques where you're just trying to squeeze and tense and stretch all muscles around your pelvis. So today we're going to be talking about a common condition that affects the sacroiliac joint called pelvic lateral translation. And what that means is when we stand, the pelvis isn't aligned with the body, but it's shifted to one side. And what happens is when we shift to one side, it overstretches the glute medius muscle. That's the muscle that connects your hip bone to the top of your pelvis. And if you understand anything about sacroiliac research and sacroiliac pain, many sacroiliac joint problems are related to glute medius weakness on that side. So when we have a lateral pelvic translation and the pelvis scoots more to one side habitually, I'm just not talking about moving there or dancing on Friday night, but when you continuously sit and stand and move in such a way where that pelvis has shifted over even a little bit off neutral repetitively on a regular basis, day after day, it creates an overstretching of that glute medius on that side and a weakness, and it affects the sacroiliac joint, either on that side or even on the other, because the other side, the SI joint, gets compressed. So one way to analyze this is to simply look in a mirror at your posture. Close your eyes, stand in a normal position, and see what you see. If your pelvis is aligned over both feet equally, you probably don't have pelvic translation. However, if you put it to a more stringent test, which is to stand on one leg and see what happens to your pelvis, look in the mirror and see if you notice a difference from right to left sides. Now, normally the pelvis may slide a little bit to the side when we stand on one leg as the body tries to neutralize its center of gravity. But if you notice that one side has a tendency to stick out more to the side, that's a side of pelvic translation. If you think about your normal pelvic motions and your posture of your legs, many times the pelvis will scoot to that side if you habitually stand with one leg turned out. If you find that you have a favorite side to stand to or to turn to with your leg out, the side opposite of the leg that turns out many times is the side that you're habitually moving that pelvis towards. You can also check this dynamically as you walk by feeling the widest part of your pelvis. There's bones called greater trochanters on both sides. And as you walk, you'll typically notice that the pelvis has a little motion side to side, not a lot. But if you notice one side has a tendency to bulge more or move more than the opposite side, that indicates you have a lateral pelvic translation on that side. It's changing tension in your piriformis and glute muscles. It's weakening your glute medius and creating all types of mechanical stresses that tighten or asymmetrically overload that sacroiliac joint, causing pain. So once you've identified a lateral pelvic translation, let's teach you a great simple exercise to help restore it, to get you out of pain and to restore normal mechanics. So let's say that I've determined in my analysis that my pelvis has a tendency to move to the right. I laterally translate my pelvis to the right. The right side of my pelvis sticks out to the right more than the left side of my pelvis does. If that's so, I'm going to lay on my side with the problem side down. So if my pelvis tilts to the right, I'm obviously going to be on my right side. And then what we're going to do is we're going to use a very simple lift of the pelvis to the opposite side. We're going to try to take our whole hips and we're going to try to raise them up. My ankles and my calves stay down on the bench, my shoulders stay down, but I'm just lifting the middle of my body. Now it's important to note that I don't need to actually lift up high enough where my hip bone comes off the table. If you don't have that kind of strength, even if your hip bone on the bottom side becomes a little lighter against the table, you're going to have success in this exercise. I'll hold it for a second or two,
and then come back down. Now I can do this exercise for repeated reps going up and down, or I could do it for long isometric holds where I hold it up and hold it as long as I can. This is a strengthening exercise, so you don't want to do this every day. This is a 2 to 3 times a week exercise with rest days in between, and it can be used for increasing repetitions or increased hold time. So every time I work out, let's say on Monday I was able to do 8 reps lifting up. On Wednesday I'm going to try 10 reps or so to lift up. If I bring my legs up on a slightly higher surface than flat, it also gives me a little increased range of motion. So that's another option you can do. You could put another bench, or as I'm using here, just a second bench, where my legs are a little bit higher than the flat bench. It gives me a little bit more area to lift up from. So use that option also. Now, using this every other day, or 2 or 3 times a week on non-consecutive days for increased repetitions or for increased hold times is great for strengthening, but you can also use it as a pain relief exercise if you're having problems with your sacroiliac joint. Same position, you're going to lay with that problematic side down, and you're just going to try to lift up. Sometimes when you're in a lot of pain, you're going to even gain benefit from a passive hold of this position, meaning that if you put a towel rolled up or a pillow underneath that hip and you raise it up and just lay on it so that your whole body is angled in a bent position, it's going to help relieve the pressure on that sacroiliac joint and take some of the pain away. There's also a standing relief position that we can practice. So to use this pain relief in the standing position, you'll simply translate your pelvis the opposite way. So again, if my analysis revealed that I usually stand and move with my pelvis translating to the right, I simply want to translate it to the left. Now, I can do this a few different ways. One of the simplest ways is I'll translate to the point of the most pain relief. If I'm having pain in my sacroiliac joint, perhaps 1 inch, 2 inches, 6 inches, wherever that position is, that feels the best. I want to hold that still for about 90 seconds to reset the muscle spindles. Those are the little receptors inside our muscles that help to tell the muscle how tight it should be, and it helps to reset all the tension in the muscles around the pelvis. And then I'll slowly come out after 90 seconds, not quickly, very slowly. Many times I'll feel relief in my sacroiliac joint. I could also use this for repetitive repetitions passively by holding on with the side that I usually translate my pelvis to, and then just leaning away to a point of comfort, holding for a second, relaxing, and then repeating for repetitions. I could do sets of 10. Now this is not a strengthening exercise. This is passive. I'm just leaning and relaxing, and after 10 reps, I'll see how I feel. My pelvis feels better. Great. If not, I may need another set or 2. So you can use these pain relief exercises, which are not fatiguing. You could use them every day, multiple times a day to relieve sacroiliac joint pain. The strengthening exercise I demonstrated earlier, where you're lifting the pelvis up against gravity, those you want to make sure you're doing every other day or 2 to 3 times a week with at least a day's rest in between, because that allows the muscles to recuperate and allows you to keep either adding isometric time that you're holding the pelvis up or the number of repetitions that you do. You want to add about 2 or 3 seconds each workout if you can, or 2 or 3 reps every workout. If you have questions or comments about this exercise or sacroiliac joint corrective exercises, feel free to write in. I'll do my best to answer. Give me a thumbs up to help share this valuable information with other sacroiliac joint sufferers. And remember, if you're looking for a great program to do a full analysis on your sacroiliac joint problem, what your alignment issues are, what your muscle weaknesses are, what your core stability issues are in the muscles and the ligaments and the fascia that hold your sacroiliac joint in place, check out our fast-track self-rehab sacroiliac joint healing exercise program. It's available at painfreeandfit.com, and it walks you through step-by-step through a full analysis of your body, as well as how to choose the corrective exercises to address your findings and get your sacroiliac joint back into health and fit for exercise. I hope you have enjoyed this video on sacroiliac pelvic translation and how to get your sacroiliac joint back into place.